In our last episode, we talked about menstrual tracking apps and why they're not safe for women as a whole. Today, with what's been going on in the media, with healthcare, with, certain, I'm going to say race-targeted policies, things like that that's been happening, I wanted to touch on Black maternal mortality. My best friend is currently 35 weeks pregnant with my godson. I myself have had 3 C-sections. The first and the last one almost costing me my life, mentally and physically. And so I feel like it's a very important topic to talk about today. For those of you that follow my page that are not Black, this does not mean that what's happening to if there is something happening to you in your community that you're not important. But there is no room in my comment section for what about me and all women. This is not an all lives matter topic. So I also have statistics, so don't argue with me, argue with your mama. Today we are going to talk about Black maternal mortality, its historical roots, the healthcare system's failures, and the implications of the current policy changes. This is going to be a tough but a necessary conversation, and we are going to dive into this topic as it is way, way, way too often overlooked. So we are going to look at today how the healthcare system has consistently failed us meaning Black women. And we're going to talk about how this current administration's proposed changes may possibly, or more than likely, will make things even more worse. So just stay with me. First, let's define the problem. Black maternal mortality refers to the death of a woman during pregnancy, childbirth, or within the year following childbirth. Unfortunately, Black women in the U.S. experience 3 to 4 times the maternal mortality rate of their white counterparts. These deaths are not just statistics. I understand that the country doesn't like to see us as human beings, but we are mothers, sisters, daughters, and our communities are left devastated by heavy on preventable tragedies. So let's break some numbers down. According to the CDC, while the maternal mortality rate for white women in the U.S. is about 13 deaths per 100,000 live births, for Black women it is a staggering 43 deaths per 100,000 live births. This gap has remained consistently wide for decades. These deaths are not about individual health either. They are the result of systemic failures in healthcare that disproportionately affect Black women. And our question is, why? Well, to understand why this crisis exists in the first place, we have to look at our roots. And I know, you guys don't want to talk about that. There's going to be some people that listen to this podcast, that listen to this and they're going to feel like, oh my God, you guys are the victims. You guys are always talking about everything that's happening to you. This happens to everybody. This happens to women too. Yeah, but Okay, let's get into it. Black women's experiences with the healthcare system have been shaped by an entirely long history of racism, exploitation, and neglect. During slavery, Black women were seen as property. We were used for forced labor and breeding without regard for our health. The trauma from this era continues to echo through generations. From 1932 to 1972, it's 40 years, people, the U.S. government conducted an unethical study on Black men with syphilis, denying them treatment in order to observe the progression of the disease. While this study didn't directly affect Black women, it contributed to a profound mistrust of the healthcare system in Black communities. And I wrote this down from an article that I read, and I want to go back and correct that, because to say that it didn't directly affect Black women is obviously false, because if you injected these men with syphilis, what did they do? They went back home to their wives, and boom. In the 19th and early 20th centuries, Black women were often used as experimental subjects in medical procedures, including forced sterilizations. Let's talk about the fact that all of you women as a whole. All of us. Oh, and what's the word? Oh, I don't want to say enhancements, not enhancements. The evolution, thank you. The evolution of the OBGYN field of medicine to black women. The fact that black women were forced to lay on a table and just be picked apart. Think about Sarah Bartman and how this woman was stood on display. And doctors would poke and prod and mess with her. And even after she died, they still picked this woman apart to quote unquote study her. Let's not forget that we are seen as less worthy. We're less worthy of care and attention. And there's still this weird, even though it's literally been disproven I don't know how many times, there's still this really, irresponsible view that black women don't feel pain or black people don't feel pain. And I can tell you as someone, obviously as a black woman who has had medical experiences or has needed medical assistance at some point in her life, we are treated like we don't feel pain. To the point where, when I go to the dentist, or when I have to go to the doctor for something, I have to exaggerate to make sure that the same level of pain management that you would give somebody that doesn't look like me, I have to exaggerate just to make sure you give me that. I went to the dentist one time and I explained to the dentist that I have a high tolerance to pain medication, so you're gonna have to hit me a lot harder than you would your average person. Even my dental assistant told the dentist that. I was having a root canal and he hit a nerve and was irritated because I jumped. Well, my mouth was numb. I'm not expecting you to hit a nerve and I'd be in pain. So he gets mad at me for jumping instead of just apologizing and going to numb me some more. Then he gets to the point where he's like packing the tooth and I'm telling him that it hurts. I'm physically crying. And he's irritated with me. Well, I'm almost done. And I had to tell them, like, listen, he can't touch me ever again after today. And shortly thereafter, he was fired. And I don't believe that it was because of me, but I'm sure other people were having this issue with him. When I had my first son, it was the worst experience I ever had in my life. I went into labor. They put me in, had to go through the emergency room because this was after hours, so I couldn't just go to labor and delivery. They put me in a triage room. I just had to sit there and deal with contractions. I begged and begged and begged and begged and begged for medicine, and they were like, we can't give you anything until we get you in a room in labor and delivery. At some point, because I lost track of time, so many hours later, they get me to labor and delivery. They get me upstairs. They have me in another room. I'm still not in a permanent room. And at this point, the contractions are so bad. They're so bad where I can literally physically feel like my bones separating. I can feel every single contraction. I could feel the grinding of the baby's head turning around. Like I could feel everything. And I was just moaning like a dead body. And I kept begging for medicine. And I was like, I can't take it. Like, please give me something. I'm honestly surprised I didn't pass out. And the only reason why I know that is because my son's father was there. I finally get in the room. I have to wait for, I forgot who else, somebody to come in. I finally get the epidural. Now, I will say thank God for that nursing team and the anesthesiologist. They took great care of me. I boohoo cried because at this point, I'm terrified and I'm in pain. And now you're telling me you're about to stick a needle on my back. And so then, they tell you, we need you to bend over and stay still. If you jump, you could possibly rupture your spine. And I'm 23 while all this is happening. So I am morbidly fucking terrified. Now, thank God for them. The nurse, she ended up just hugging me the whole entire time while I went through it. And then eventually, I lay down. And guess what? Epidural only takes on one side. So I'm numb on one side and I'm feeling everything on the other side. And so then they started the Demerol. And thank God for the Demerol because I was able to go in and out of sleep at certain bouts. But then when it would wear off, I'd wake up and I'd be in pain. Another thing that happened to me that I did not, I did not consent to, was they kept bringing students in and out. I never said I was uncomfortable with. I never said I was comfortable with that. I never gave the okay for that. The doctor that was supposed to be delivering my baby, I don't know where that lady was. I never saw her. I didn't see her until after I had my son, when I went for my checkup.
That's a kick.
These people kept sticking their hands in me, touching me with shit. Like, it was the most uncomfortable and dehumanizing experience. And I'm oh my God, my son, okay. I don't want to cry on this, y'all. I'm really trying not to. And you guys know on this channel, like, I always talk about the things that I've gone through, my experiences, because I know that they can help somebody else. But I've never gotten emotional. I've always been able to control it, but I apologize in advance if I get a little emotional. But I just think back now and I'm like, my son will be 12 on Sunday. Ooh, okay. I'm trying to get this together, y'all. I'm so sorry. My son will be 12 on Sunday. And the fact that I can still remember how traumatizing that was for me, and how I was told to speak up and advocate for myself and nobody listened to me, and how people in this country treat us like we're nothing. We die, no one cares. We get murdered, no one cares. Accidents that shouldn't be accidents, no one cares. You lose your child, no one cares. Except for the people that look like you. And some of them, they're so disgusted by looking at you because it reminds them of who they are. And so they mistreat you. Whew, okay, we're going to get through this. I apologize, y'all. I apologize. So, it was just a lot. And I remember we got to a point. Let me just tell y'all that I was in labor for 59 hours. And I kept that paperwork because it still blows my mind to this day. And, okay, let me get to actually having him and then the after part, the postpartum, and I'll get to all of that. Okay, so we go through all of that, and then at some point, I'm not progressing. I get stuck at 8 centimeters. Oh, I forgot to tell you guys. So I want to say maybe about day 2, they're like, oh, you're not progressing. You're not passing by 8. So we're going to give you Pitocin. For those of you that don't know, Pitocin is a medicine that they give you that intensifies your contractions. So it's supposed to help speed up the labor. Okay. So they hit me with this Pitocin. Now remember, I was telling you guys that my epidural only took on one half of my body. So the other half of my body felt everything. Contractions already hurt naturally. So imagine this is like contractions on steroids, literally. So now I'm just in an amount of pain that I literally would not wish on my worst enemy. So we get to a point where they come in and check on me, and I asked them, I said, please, can I please just have a C-section? Like, I can't take this anymore. Like, please just get him out of me. And I was concerned for him because they got to a point where they were telling me that they couldn't give me any more Demerol, and I was just going to have to, like, proceed with labor however I was going to proceed because they didn't want him to get so sleepy that he's not responsive. Mind you, I'm 23 years old, so now I'm just freaked the fuck out. So they get me into the room, they get ready to prep me for surgery, and this lady, I remember her telling my son's father, like, I think that we should try vacuum assisted first before we would proceed with a C-section. Here they go, once again, not listening to me. And I looked at him and I said, I don't want that. And I was very adamant. I said, I don't want that. I said, and I'm terrified that they may break my baby's neck or something. I don't want that. And he looked at me and he said, okay. And so when they came back in, he said, she does not want that. And this bitch had the nerve to say, are you sure? What do you mean, am I sure? I told you I didn't want that. I asked you for a C-section. I did not ask you for a vacuum. And I'm going to get to why. This is why you listen to your intuition. I'll get to that in a second. So We go through the process. I do remember that the anesthesiologist, she gave me this shot, and I don't know or remember what it is, but all I know is I felt this sharp pain in like my shoulder, and then I fell asleep. And it wasn't meant to put me to sleep, but I just think that my body was in so much shock that by the time it was no longer in pain, my body just was like, yeah, we're going to bed. So I do remember, I remember all the tugging and pulling and stuff like that. And then I remember them, I do remember when they pulled him out. I do remember hearing him cry. And then they brought us to the recovery room. And from there, everything was everything. My nursing team was amazing. We were in a shared room. That lady, all of her people that came in and out were super loud. And so I remember talking to this nurse, and she was just like, as soon as I get an open room for you, I'll move you. And she did. Now, here's what blew my mind was every single time the nurses would do a shift change and they would introduce me to the next nurse and they would read off my stats. They kept saying, you know, mom was in labor for 59 hours. And every single nurse, not only did they have a look of shock on their face, but the poor things looked at me like, what the fuck? Like, no way. Because I later learned that you are not supposed to keep a woman open for more than 48 hours. They allowed me to go an additional 11. Because of that, my baby developed some bacteria that he would not have had if they didn't take him out sooner. By the grace of God, they were able to give him the antibiotics that he needed, and he was able to come home when I went home. But it was so traumatic, obviously, because I ain't never cried on Beyonce internet. But it was traumatic, and it was a whole lot of people not listening to me. My second pregnancy, everything was everything. I had a different OB this time. I went to a completely different doctor's office, and I was great. The third one, I contribute a lot of that to COVID. I don't contribute that to like my Black experience, but I just do like, I think everybody, the nurses included, were just afraid of what was going on. But I had this anesthesiologist, and she just, for the love of God, she just wouldn't listen to me. And she kept sticking this. She literally put the damn catheter. Because when you have a scheduled C-section, you get a spinal block because you're not going to be in there as long as you're not laboring. And she just, for the love of God, would not listen to me. I could literally feel the damn catheter in my back, like bending. And so eventually, I told my OB, I told him, I said, okay, Dr. Kaysher, I'm scared. I said, this is not working. She's hurting me. I can feel everything. She's hurting me. Please tell her to do something else. And thank God he listened. And he said, okay. He said, I'm going to put you to sleep. And I looked him dead in the face. And I said, you took care of me last time. Because my last two babies are a year and a half apart. I said, you took care of me last year. I said, I want you to know that I do trust you. But I have to be honest with you. And I have to tell you that I'm scared. And he said, I understand. He's like, that's normal. He said, I promise you that I will take care of you. And this was COVID, so technically Nick was not supposed to be in the operating room, but they made sure that they went and got him so that when I did fall asleep, he was there, and when I woke up, he was there too. And I'm so grateful for that. But this time around, the nurses were not kind to me. There was a certain demographic of nurses that are known to not have great bedside manner, and I happen to have that demographic of nurses. So you guys have to think, I just had a C-section. I have like they get you up and they want you to start walking. And so they take the catheter out, but I need help getting out of the bed. My stomach has now been cut open. I'm ringing the bell to get help. Nobody wants to help me. Baby's crying. I can't even get up. Like, y'all, I felt like a disabled person. I was finding ways to reach out to grab Ayana. They would fuss at me about having her in the bed, but I'm like, no one's helping me get up out the bed to get to her. So the only way that I can get to her to make sure that I give her what she needs is to keep her in the bed with me. So what I would do is, instead of having her like sleep under my arm so that she wouldn't overheat, what I would do is I would lay in the bed with like my legs open, and I would lay her in the middle. So she would sleep on her back in the middle. So that way I could make sure, of course, she didn't fall or anything like that. But I have so many stories. You guys got to think, I do hair. I have stories. I have a client who went into labor in her car, drove herself to the hospital because she said that she called to tell the EMTs what was going on, or like called for an ambulance to come to her car. and she was having a contraction, and she grabbed like the ENT's hand, and he snatched his hand away. And she's like, you know what? I'm probably better off just driving myself. So she drives herself to the hospital. They put her like in triage in the hallway, y'all. She had them babies in the hallway. The babies did not make it. She's screaming. She's doing everything else. They only moved her into a room because she was screaming because she was in pain. Then hours later, someone comes to check on her, and they look at her and they're like, oh shit. Because the sac is literally between her legs, and she's just sitting there like, what do I do? She's losing blood and everything. She calls her husband. Once her husband gets up to the hospital and starts pressing, now everybody wants to move around and do their jobs. After they clean her up and get her together, a nurse comes back in and tells her, I'm so sorry for your loss, but the good thing is you can do it again. I'm so sorry. Like, we get told that we're always playing victim, but let's keep it a buck. A lot of people's experience is not like ours, which is why people act so shocked when they hear these stories. So, fast forward to today. With just those examples that I provided you, it's clear that the healthcare system continues to fail us in several key ways. So, first and foremost, implicit bias in healthcare. Studies show that healthcare providers often have implicit biases that affect their treatment of Black women. Exhibit A and B that I just gave. These biases lead to misdiagnosis, undertreatment, and lack of proper care. For example, a Black woman might be more likely to have her pain dismissed, or concerns about her complications might have been minimized. Many Black women, especially those in low-income communities, face barriers to accessing high-quality prenatal and postnatal care. This can lead to undiagnosed complications during pregnancy, delayed interventions, and lack of support during the critical postpartum period, which is what I myself went through. Conditions like hypertension, preeclampsia, and postpartum hemorrhage disproportionately affect Black women. But when these conditions arise, Black women are more likely to experience delayed treatment or mismanagement, resulting in higher rates of death or severe complications, which is why you have women that pass away in their first year of postpartum. And then the doctors act like they don't know what the fuck happened. I thank God for my doctor and my nurse practitioner for my last two pregnancies, because I had some swelling in my legs that I didn't know what was going on. And I remember my doctor telling me, like, when I left the hospital, not my OB, but my nurse practitioner, sorry. She called me and she told me, she said, if you experience any swelling or if you just overall feel like something's not right, you call me immediately and I'll schedule you to come in. And that's exactly what happened. I was talking to her one day and I said, hey, my right leg is swelling like nobody's business and I'm scared. And she was like, what are you doing today? And I said, nothing. And she was like, you come in ASAP. And so I got in there, she checked me out, and by the grace of God, it was just water retention. She gave me some water pills. I was fine. But you have so many people. I have an ex-friend of mine that was literally like damn near dying her entire pregnancy, and she was in Orange County. And there's a large demographic of people in Orange County in the medical field that do not give a damn about people that look like us. And I kept begging her, like, please, I understand that this is your doctor. Excuse me, I'm trying to adjust myself. I understand that this is your doctor, but your doctor is clearly telling you that he does not care about you and your condition. If you go into labor, please go to a different hospital or come back out here to LA. And like, this is really a thing. On a systemic level, racism continues to influence health outcomes. Black women experience more stress due to racial discrimination, which can lead to chronic health conditions that complicate pregnancy. Studies show that even when controlling for factors like education and income, Black women still face higher risk of maternal death. So, for people that like to make it seem like it's a poverty issue, in some areas, yes, it can be. But there are some doctors that are mad that you can even afford to see them. I'm in a more well-to-do area. Now, I've been lucky that where I live now is so culturally diverse that I haven't run into any issues as far as like when I go to the emergency room or I have to go to the urgent care, which is rare. They do take great care of me, but I had issues with people acting or mistreating me when I was in those more urban areas. this is going to get deep. So let's talk about the current administration. And I'm saying that very reluctantly because it's just draining to think about. But what does this mean for the future? Well, the current administration's proposed changes to the healthcare system could make this situation even worse for us. So, the Affordable Care Act, or Obamacare, helped increase access to healthcare for low-income individuals, including many of us Black women. But some states, led by conservative governments, are rolling back Medicaid expansion. Well, we now know that there has been a freeze to Medicaid overall. So at this particular moment, amen. Without this coverage, many may lose access to the prenatal care that they need. The recent wave of state-level restrictions on abortion access and family planning services has disproportionately harmed Black women. These policies ignore the unique struggles that we face, such as higher rates of maternal complications, limited access to healthcare facilities, and economic barriers to care. Programs that focus on maternal health, such as maternal infant, early childhood home visiting program, it's called the Maternal Infant and Early Childhood Home Visiting Program. I can't read my own writing. Have faced cuts or underfunding in many states. These programs provide critical support for Black mothers, especially those living in underserved areas, by connecting them with healthcare resources, education, and community support. Reducing funding to these programs only exacerbates these disparities. Black women, especially in low-wage jobs, face challenges like inadequate maternity leave, lack of paid sick leave, and unsafe working conditions. The current administration's push to reduce worker protections, including paid leave, threatens Black mothers who are disproportionately employed in jobs without these benefits. In short, the healthcare policies being proposed or implemented today are not designed with our needs in mind, obviously intentionally. Instead, they risk deepening the inequities and health disparities that have plagued our communities for generations. So, moving forward, what can we do? What can we do to combat this crisis and push for change? First and foremost, we can advocate for policies that expand access to quality maternal health care for women. This includes pushing for Medicaid expansion, ensuring access to reproductive health services, and demanding that healthcare providers undergo cultural competency training to eliminate implicit biases. Let me say this. I have a cousin, that is a doula. And I feel like if you are a Black woman in the medical field, please consider being a doula or a midwife, because you may be the very thing that saves your fellow sister's life. If I'm done having kids, my tubes are tied, but if I was to ever have a child again, I would ask my best friend to be my doula. She does not like maternity, she does not like labor and delivery, but I swear to God, I don't trust another person. With my weight loss, you guys know I've been on a weight loss journey, and I've lost almost 100 pounds. And I have talked about eventually wanting to have a skin removal surgery done. And, a lot of these places you can do a recovery house, but a lot of people are not treated well in recovery houses. And I had already made the decision that I would hire a private nurse. Well, my best friend is an RN, and her other best friend happens to, she's really, really versed in wound care. It's kind of like the thing that she loves to do. And I already said it'd be them two taking care of me. My other best friend lives in Georgia. She's a nurse as well. I apologize for the background noise. We do have a neighbor that is on the spectrum, and he's nonverbal. So hopefully it doesn't bother you all too much. Yeah, so support organizations working to improve maternal health outcomes, such as Black Mamas Matter Alliance and the National Birth Equity Collaborative. These organizations are providing resources, education, and policy advocacy to address maternal health disparities. Use your platform. I don't care if you have 2 followers. I don't care if you have 2 million followers. I don't care if you have 2,000 followers. There's always somebody watching and listening. Do not let the likes fool you. Always notice that the views, there's more views than you'll always get more views than likes. This is important. We all matter to each other. Use your platform, whether it's social media, community organizing, or even just to talk to your family. So One of the things that me and my best friend do is we talk amongst each other. We talk to our children, we talk to each other's children, and in turn our children go and talk to their friends. So you can pass things on that way as well. Same way our moms and aunties and grandmas used to. And the more people understand the crisis, the more pressure we can make, or more pressure we can put on policymakers to make real changes. And finally, the most important of all of this is listen to Black women. Listen to us. If nothing, if you guys have not learned anything else by what's been happening during this whole election aftermath, is listen to us. We know shit. Switch your mind off of that, oh, they're always victims, and oh, it's always woe is me, and actually listen to what the fuck we're saying. Listen to us. You think we want to live the life that we live? Yes, I love being a woman. I love being Black. I love being a Black woman. But I don't love the negative parts of being that. And I just feel like if enough people are telling you, hey, this is happening to us, it wouldn't kill you to fucking listen. Listen to us. Listen to us when we share our experiences. Listen to us because we're the ones being directly affected. And understand that if it's happening to us, you guys aren't too far behind. Women are women. We're all being affected. But because we're the majority, you guys don't seem to care. But let me tell you something. What this current administration has taught us all so far is ain't nobody above the program. And we're seeing that now. The wild part about this conversation is that we have only scratched the surface. This is a deeply ingrained issue, but it's clear that Black maternal mortality is a public health crisis and the healthcare system's failures are to blame. The policies being rolled out today could make this even worse unless we choose to act. And I want to remind you guys that while this in particular is a Black issue, Black issues are everyone else's issues as well. Just like what's going on with this whole DEI, these DEI rollbacks. Everybody laughed at it when they thought it was just going to affect Black people. Baby, it was never there to help us anyway. Now you're seeing people that were so happy to not, at least I'm not Black. Yep, but you're starting to look like the rest of us now. But anyways, y'all, I appreciate y'all listening. If this episode resonated with you, share it, talk about it, and let's continue to advocate for change. Our lives depend on it. Until next time, take care of yourself and each other. I love and appreciate you all very much, and I will see y'all in the next one. Bye.